Thank you very much. Well, welcome everyone. A big welcome to this UN Statistical Commission high-level side event. It is called the COVID-19 pandemic, how the data and statistical community stepped up to new challenges. My name is Jenna Slotin. I'm the Director of Policy of the Global Partnership for Sustainable Development Data. Well, it goes without saying that the COVID-19 pandemic has created an unprecedented and urgent demand for data and statistics. And many NSOs have risen to the challenge. 62% of NSOs around the world have launched new data collection efforts to monitor the impact of COVID-19, and over 50% have set up platforms to serve public data needs. This has required partnerships between statistical offices and other parts of government, as well as partnerships with external stakeholders in the private sector, academia, and civil society. This event will provide the opportunity to look at the challenge caused by the increased data demands amidst serious disruptions to statistical operations that have been caused by the pandemic. It will also highlight the response in several countries, and we will discuss what type of support to countries has been most effective over the past year. Finally, we'll also discuss how the statistical and data community can build on these experiences to move towards stronger data systems that can produce timely and quality data, but that are also agile and resilient in times of crisis and disasters. So this event will be split into 2 sessions with outstanding experts from the global statistical system, private sector, and civil society. In the first, we'll hear from 3 statistical offices who will present the new demands they've had to contend with and the new uses of data by countries for COVID-19 response. In the second session, we'll have a discussion with a diverse panel of experts on the responses to the current crisis in their own organization or country. I'll remind you that the event is being live streamed and recorded. And now I'm very pleased to welcome our keynote speaker, Mr. Stefan Schweinfest, the Director of the UN Statistical Division, for his reflections on how the global statistical system has responded to countries' needs and demands during the pandemic. Over to you, Stefan.
Good morning, good afternoon, good evening, everybody, wherever you are on this planet. Thank you, Gemma, for getting us off to a great start. I must say I am super excited. I see so many familiar faces, and I'm just plain happy to be here with you and talk about perhaps the most important topic that we have before us right now. But I will indulge for 1 second into dreaming. If I close my eye, it's Monday afternoon. It is our high-level forum, and we are starting the Statistical Commission Week all together in New York. It's not happening this way this year, but it will happen hopefully next year again and in all future years, bringing us together. And it's happening virtually, and I thank you for being here. It is 2020, 2021. We cannot have any kind of event without talking about COVID. So this high-level event is, of course, dedicated to this topic. I would have liked to call this event From Disruption to Solidarity, because this is what we have observed. I mean, it was a major disruption. It was, in a way, a perfect storm. There was the crisis itself that has, of course, increased the data demand on our community enormously. In the background, we have the SDGs going on, and we are moving into the decade of action, and we are being asked to accelerate and bring new data for the Sustainable Development Agenda. And all of this is happening against the backdrop of increasing resource shortages. And so, I mean, it is literally the worst possible situation I could possibly imagine. And but what did you do? What did many national statistical offices do? You actually jumped into action very, very quickly, making it obvious that every crisis is also an opportunity. We saw long overdue investments in IT infrastructure. We saw you developing new fieldwork protocols for face-to-face interviews to to adjust the ongoing census programs or to modify the survey programs that you all had. We saw new ways of using innovative data sources that were given to you in the crisis moment that could be used to help and support official statistics, something we had been reflecting upon in the big data agenda for many, many years, but now it was happening in unprecedented ways. Putting new challenges on your leadership. I mean, you were developing new concepts of data governance and data stewardship, and also new ways of communicating with your users. So I have been mightily impressed and been very, very proud to be part of this global statistical community that has responded in such an agile way and also acted in solidarity. It was not one country against the other. It was we created a website, and it was a website of problems and solutions. We shared solutions, and I think that was really also the pleasure of being a United Nations person in this moment of my life, because we could bring everybody together and we could bring also the solutions together. And let me just mention a couple of things that we did. With my colleagues from the entire UN system and beyond in the Committee of the Coordination of Statistical Activities, we published several notes of what each and everybody in the UN has been doing to respond to the crisis and how we have been helping. We've had new partnerships, for instance, with ESRI, that is here also on the panel, to integrate the geospatial tools. This was the moment. Everybody was looking at maps and statistics. We have created a website, as I said, where we created a platform. The United Nations doesn't have all the answers, but we can put a table in the middle of the room and get the people together and find the best answers. And this is what we are doing today. In partnership with the Global Partnership on Sustainable Development Data, we launched a new program on administrative data records and how they can be better used. Other innovative data sources under our big data program. With our partners in the UK, we have been having this ongoing program of creating SDG data platforms in 20 developing countries. And with the DFID program of the FCDO, new acronym, we quickly adjusted on how we work with our developing country partners in a virtual format. We have launched with our friends in the World Bank and in the Regional Commission a survey to feel the pulse, what is needed and what is the most urgent need in countries, and not only with a view on the short term, but also in the long term. Because I think that is the very exciting moment that we find ourselves right now. The crisis has highlighted all the things we have been discussing for a long time. Data ecosystems. Who are our new partners? What challenges do we have for data governance? What is our data responsibility? And what is a new data culture that we all need to develop? And I think at this moment in time, after 1 year of crisis, we may just be slowly moving, hopefully, out of the crisis management mode towards managing a new normal, because we all know we will not go back to where we were before the crisis. And this is an enormous creative opportunity. And I'm really looking forward to working with all of you here together. So to listening to all of the presentations today, and whether you are countries or you are partners, and figuring out what we can all do individually and together, and how we as the United Nations can best support you at the national and at the international level to move forward. So thank you for being here, and thank you for this opportunity to set the frame a little bit for our discussions today. Back to you, Jenna.
Thank you very much, Stefan. Great to hear everything that's been happening from the perspective of the Statistics Division and that message of solidarity, which I think we're going to hear an awful lot about in today's discussion. So now we're going to move over to hear from a number of countries about their experiences, best practices, and challenges, and how they responded to address new needs and data gaps that emerged during the pandemic. First, we'll hear from Sir Ian Diamond, who is the National Statistician of the United Kingdom. Over to you.
Thank you very much. It's an enormous privilege to have the opportunity to speak to you. Are there slides and are they available? In which case, I will talk through my slides. Look, in the UK, one of the things we've noted as we moved through the first wave in April 2020 was that actually we didn't know enough about the prevalence of the virus in our community. That's particularly the case given that 1/3 or so of cases are asymptomatic. And so what we agreed to do or decided to do was to set up a large household survey. So a representative household survey of right across the UK. The data I'm going to show you are for England. And what that does is take PCR swabs in all members of the households over the age of 2. It also takes blood from a subsample of 10% of the households, although now in the context of vaccines, we are upscaling that. And the slide that you can see in front on the left-hand side shows the prevalence across the population of testing positive through both the very low levels in the summer of last, then increasing. There was a lockdown in November. You can see that come down, and then a big increase, and you can see going through to the 6th of February, the decline. We do 150,000 households in this, 150,000 swabs in this survey. We produce results weekly, although we produce estimates twice weekly. And with that 150,000 sample, we can produce regional estimates, which is incredibly important because the differences across our regions of England have been quite major during the second wave. The right-hand side just shows the journey from December through to February regionally, and you can see that the major outbreak in London has come down very quickly, but some of the other outbreaks in other regions have not moved so quickly. Next slide, please. The second thing that we did was to say, well, okay, we need to be able to inform government of the success of its non-pharmaceutical interventions, most notably initially the lockdown. And the way to do that is to understand mobility, because clearly what a lockdown is trying to do is reduce mobility. And so we did this in a number of ways, using, for example, telco data. But here I show a slide which comes from some web scraping we did of Google place data, and it just shows very quickly the red vertical line is the date of a lockdown, and what you can see is that in workplaces, transit stations, and even indeed parks, the lockdown was pretty successful, with the only increases being year on year in residential areas. And we've done a lot of this kind of innovative data collection to inform the success and to monitor the impact of the non-pharmaceutical interventions. Next slide, please. But of course, we're also incredibly worried about the economy. And one of the things was clear was what the impact on businesses of all the lockdowns that were happening. So we stood up very quickly a business impacts of coronavirus survey. This survey is now in its 25th move through, and I'd have to say it's incredibly successful, and we work with colleagues right across government to organise the questionnaire so that we are asking questions which are of real relevance, and one that's of real relevance is what sectors are using the furlough scheme, and the left-hand graph there, just an example, shows that the darkest of those colours is the proportion of people in different sectors who are using furlough, and you can see that in arts, entertainment and recreation, and indeed in leisure and hospitality, that's where it is very high, and much less in construction, where people are much more likely to be working in their normal place of residence. And you can then also see some areas like, for example, real estate, where working remotely has become the norm. So being able to inform policy in that way has been important, and also understanding the impact on employment. And we have been able to produce much faster indicators of employment than we have in the past, really bringing out a whole series of faster economic indicators. But I just thought I'd give a long-term view, and going back into the 1970s on the left-hand side with men in green, women at the bottom of that, and showing the employment rates for those two, and then people overall. And what you see is that things were steadily going up, and then you can see right at the end a drop of 1.1%, a really steep drop at the end. Next slide, please. And of course, we're now moving forward into vaccination, and one of the things we're doing is really studying the quite remarkable rollout of vaccination that has taken place in the UK. Now, the great majority of people over the age of 60 have had at least one dose, and that is enabling us to follow up people very quickly, and to look at adverse events, of which there are tiny numbers, and secondly to look at the impact on immunity and on transmission. But we also have been running, we're now in the 41st version of an opinion survey, and I thought I'd just show you two slides from the opinion survey, which asks questions about vaccination, and particularly looking at vaccine hesitancy. And the slide on the left shows by age that the older you are, the more likely you are to say that you will have the virus, have the vaccination. And on the right-hand side, it breaks that down by ethnicity, and one can see pretty quickly that those people from Black heritage are less likely to say that they will have the vaccine, and that's the focus now of a large amount of policy in the UK in terms of advertisement, with a lot of influencers really trying to promote the use of vaccination. Last slide, please. And I just thought I'd also just say a few words about what we've been doing, because it's not the Office for National Statistics sitting in a darkened room with a cold towel on its head doing things and throwing them out to the community, hoping that they will be collected. We've been working very closely with government to provide insights to government. That survey that I showed at the beginning has just done its 3 millionth swab, and the Prime Minister sent me a personal letter this week to thank us for everything we've been doing, informing the decisions. But that's at the central government level. At a local area, we've been putting out local area profiles to understand what's going on, because a lot of the decision making is done by local directors of public health in conjunction with local resilience fora. We've been working very closely with the new National Institute of Preventive Health to combine our data with test and trace data, and with other indicators of outbreaks, for example, those in particular workplace settings, to do this in as much real time as possible. And the point about geospatial, Stefan, is well made. We're doing this in flexible geographies, and also looking at the impact, doing some real regional modeling of the impact on businesses of the pandemic. And finally, we've been doing an awful lot of record linkage to understand the linkage, for example, between, sadly, those people who have died and occupational background and other characteristics. And that requires that we are able to link data, for example, from the census with test and trace data, with death registration, with other data sets. And we now have available a public health data asset, which is available and being used enormously by the entire research and other community to understand the pandemic and those people who've been most affected, and now the impact of vaccination more greatly. Thank you very much.
Thank you very much. What an interesting presentation and very exciting to hear the different steps that you've taken in the UK. A quick reminder to everyone, if you're not a speaker, please turn off your camera so that we can save on bandwidth and ensure a smooth connection. And now we will move over to Ghana, where we will hear from the government statistician, Professor Samuel Anim. Please, over to you.
Thank you, Jenna. Good morning, good afternoon, good evening to all. Can my screen be seen, please?
Yes. Grateful if you could go into full screen.
Thank you. Thank you very much. This is a very huge opportunity for us in Ghana, and thank you very much for Ian for the presentation. I think the earlier discussions that we had at the early stages of the pandemic influenced the kind of things that we're doing in Ghana, obviously learning from the exciting things that you had already started in the UK. So my presentation really looks at what we are tasked to do, and I looked data demands and the use of data in the COVID-19 response. And I italicized the unsolicited demands because one would argue that once it's a demand side argument, then it should be the need. But at the onset of the pandemic, what we did at Ghana Statistical Service was to go through the thinking process to ask ourselves, how relevant can we make ourselves as an institution? And that is why I think we need to look at some of the unsolicited things that we did at Ghana Statistical Service, which more or less followed what they were doing in the United Kingdom. And also I'll touch on some of the solicited, that is the demands for data from the government side, and I'll end up with the use of data in the COVID-19 response. So as was mentioned earlier on, we also thought of the need to have a dashboard, and it was the responsibility of the Ministry of Health to be providing updates on the infection rate. But to make ourselves relevant and to contribute to resolving the pandemic, we did not just put an update on the infection rate and the testing rate and so on, but we augmented that data with what we call vulnerability indicators. So specifically, we looked at areas that had a lot more of the aged people, 60 plus, areas that had people who were smoking, areas that had people who were not adhering to the protocols, such as they did not wash their hands and so on. So on our dashboard for the Ghana Statistical Service, the COVID-19 dashboard, we augmented the infection rates, disaggregated it at the regional and district level with this information that we thought makers to areas that are likely to have high incidence rate. The other thing that we did was to leverage on our collaboration with the telcos, and also this was one of the things that Sir Ian mentioned. Essentially, what we wanted to do was to use core detail records to see the extent to which the partial lockdowns that were instituted somewhere towards the end of March would impact on mobility of people and therefore reduce the infection rate. This really led us to realize that it reduced the mobility rate to about 50% in the lockdown areas, whereas in the places that we didn't experience any partial lockdown, mobility remained as it was pre-COVID-19 and during COVID-19. The third area that we thought from an unsolicited perspective we should contribute to the resolution of the pandemic was for the first time to roll out telephone interviews, and we didn't have capacity in-house. So what we did was to look into the space of the private sector to see agencies that have experience in the collection of data using CATI, and we found one and we partnered with them. And this is the new collaboration that we've extended even up until now, and we're looking at going forward to work with this private sector in the area of data collection and complementing the things that we are doing as far as data collection is concerned. So during the COVID-19, we rolled out 3 different rapid surveys, specifically the households and jobs tracker, the business tracker, and the local economy tracker. I want to touch on the local economy tracker because it was not very much consistent with what was happening in other jurisdictions. And here the whole idea was to think about how the network system, the social network system, the cultural system could sort of provide some resilience against COVID-19 impact vis-a-vis what the government institutions were doing. So this exercise also is providing us the platform to see whether we can get into some regional computation of GDP moving forward, which currently we are not doing. Then we go on to the solicited areas in terms of what government really wanted from us as a statistical agency. So around the heat of the pandemic, the first call that I got from the ministry was, how do you help us identify people who are most affected by the pandemic? And looking at the kind of data that we collect, mainly repeated cross-sectional data and the decennial census, I straight away told the minister that it would be difficult to get that because we do not have cohort analysis to help us follow up on people and see their current poverty status. Then the second demand was a savings rate. And here, although we do have the savings rate at the national level, to get a sense of the sectors that will be resilient, different households that will be resilient, and also businesses and different locations, they wanted data on the disaggregation of the savings rate to give them a sense of the resilience across these sectors, type of household and businesses and location. And definitely this is something that we were not able to provide simply because the kind of surveys that we ran, as I indicated earlier on, are more of repeated cross-sectional surveys, and we do not integrate business surveys and household surveys. So from a we are not able to look at it, these perspectives. Then the third area that they thought will help sort of identify persons was if we could give them the locality poverty rate and population distribution. And again, we could only have touched on this because our last census was in 2010, and what we had now was population projections up to 2020. And then with the poverty rate that is based on our living standard survey that we collect every 5 years, we're not able to provide readily data on the poverty rates and the population distribution at the locality level. So clearly, our inability to respond adequately to these demands has created the sense for us to look at how we engage with statistics as a country. In terms of the last area, sorry about that, there are two things that we are emphasizing on in terms of how we're going to use data moving forward. The first one, which we are taking advantage, is it's provided us the platform to think about how we're going to integrate these rapid trackers into traditional surveys. This year, we're going to do our population housing census. Definitely, we will not be able to do that, but come next year, we're going to roll out our business survey. We're going to roll out our annual household income and expenditure survey, and also start preparations for our Ghana Living Standard survey. Because we've not been able to do panel cohort studies over the period, one of the things that we're taking advantage now is how to integrate these samples from the rapid trackers into any of these surveys that we're going to roll out come next year. So we're preparing ourselves for the first time to see how we can begin to have some cohort analysis at the household level and at the business level. The second area in terms of the use of data was mentioned in Sir Ian's presentation is we asking ourselves how we can contribute to the assessment of the impact of the interventions that were put out by the government. The challenge that we have now, which we've started engaging government in discussion on, is these interventions are made without recognition to how we can estimate the impact of the interventions. So at Ghana Statistical Service, we are not privy to how the targeting selection of beneficiaries are done. So we are now fortunate to be on the panel of the COVID-19 response, and we are engaging them that for us to be able to assess the impact, we should be part of how the beneficiaries are selected, so that based on the data that we collect on the trackers, we can always go back to do an impact analysis. Just this morning, we were fortunate to have our first round of vaccines arriving in the country. Obviously, this is something that we could have done the kind of things that our colleagues at ONS are doing. But again, this is another area that we've not been involved in how the first 200,000 batch of vaccines will be distributed. But definitely, this is a huge platform that we're getting learnings from, so we can take these learnings out there to get them to know that we play a role in this regard. Another area that I think we should put emphasis on is how we can continue to make ourselves relevant, especially at the time that we're seeing the emergence of new variants. We have just seen the wave 2 hitting its peak somewhere. Last week, it was about 700 cases a day, and just yesterday, it reduced to about 500 cases a day. So we're not too sure whether we've peaked on the wave 2 and it started decline, but definitely this is something that we need to position ourselves, especially when we are thinking about if there's going to be any subsequent waves, how we're going to position ourselves in that regard. Thank you very much.
Thank you, Professor Anna. Very interesting to hear the steps that you've taken and how you're looking to integrate this new work into your future operations. Really exciting. I want to keep encouraging everyone to put questions into the chat. I want to also welcome comments. I noticed that Julia Santillana from Mexico shared some of the actions that they're taking in Mexico, and so we can have a bit of a discussion and audience engagement in the chat as well. So now, without further ado, we'll move over across the ocean to Chile, and we'll hear from Sandra Quillad, Director of the National Institute of Statistics of Chile. Please, Sandra, over to you.
Thank you, Jenna. Good morning, everyone. For our institution, the opportunity to attend this meeting is of great relevance because it provides us with the space to exchange our experience and strategies in confronting the health and economic crisis triggered by the COVID-19. Next, please. The first challenge we faced was maintaining operational continuity with our normal statistical production processes. The health crisis forced us to adjust fieldwork protocols by introducing measures for the protection and care of the staff and interviewee to minimize the risk of contagion. In the first phase of the pandemic, we had to suspend face-to-face data collection and rapidly transition to teleworking while concentrating on telephone and web-based data collection for our main products. We have continued this mode of collection, limiting face-to-face collection to priority data that cannot be accessed remotely. Telephone interviews have been an important adaptation to our collection processes, especially for household service. Before the pandemic, however, this mode of collection was seldom used in our institution. Thus, we had to adapt our computer system and work procedures to ensure the continuity and publication of our main indicators, like the National Employment Survey. Because our economic surveys of enterprises are based on self-reporting through web forms with the assistance of analysts, this mode has not been altered. The greatest challenge was communicated with the companies that had suspended their activities or that had transitioned to teleworking. Both situations negatively affected their response level. For price statistics, we have drastically reduced face-to-face collection, reserving this mode for establishments whose prices cannot be collected by telephone or through the web. In contrast, price capture from websites has significantly increased. In addition, the pandemic has led to an increase in our use of complementary data in administrative records, where food prices in some establishments can be found. Next slide, please. During the pandemic, one of the most important issues has been the timeliness of information. To maintain production under changing conditions. We have taken several measures to adapt our production to priority information needs. The first is dissemination activities, where we had to focus communication of the impact of the pandemic on statistics. For example, presentation to the public and the publication of technical documents. Increase the provision of georeference data. we launched a geostatistical platform to identify active COVID-19 cases and to provide socio-demographic population data generated from census information and economic statistics. Change in product planning and publications. For example, we rescheduled the structural survey related to the earnings and labor cost indices and the agricultural and forestry census and the population and housing census. Both of them is rescheduled for 1 year. Suspension of operation because of the health measures and budget cut. We had to suspend the National Time Use Survey the last year. Despite this limitation, we have produced updated information regarding the impact of the pandemic and on the country's socio-economic situation by incorporating thematic modules in the National Employment Survey and the Earning and Labor Cost Indices. With the collaboration with the Ministry of Social Development and Family and the UNDP here in Chile, we developed 2 versions of a special household survey whose purpose is to assess the impact of the pandemic on the living conditions in our society. And last, finally, we have always highly valued the technical support of international organizations like ILO, ECLAC, UNDP, IDB, World Bank, and even more so now under the changing circumstances of the pandemic. In that way, together with the ECLAC, we have led the Knowledge Transmission Network, which provide the region's statistical offices with a space to share experiences and practices of adaptation during the pandemic, thus strengthening our processes and helping us to improve as an institution. And thank you for your attention.
Thank you so much. Really interesting contributions there. So we're running a little bit short on time, but I do want to bring one question back to the 3 panelists. I also want to flag that there was a question in the chat about resources and tools that are open source that are available in relation to pandemic response. Stefan Schweinfest shared in his keynote website that the UN Statistics Division has been putting together, or rather a page. So if the colleagues could maybe put the link to that in the chat, that would be great. So we'll circle back, begging you to be really succinct and to maybe give a 1-minute response, each of you, to the following question. We've had a question from some of the registered participants prior to the webinar to understand a bit more about how each country is taking steps to highlight the differential effects of COVID-19 on different groups, and particularly how inequalities are perhaps being exacerbated. So how are you addressing those unique, smaller population groups that may be more marginalized or vulnerable? So over to you first, Sir Ian.
Thank you very much. A really important question, and one that we have taken very seriously. So, for example, we put a lot of work in the first couple of waves into looking at mortality and linking death certificates to census data and to other sources, and that enabled us to show that those people from Black heritage backgrounds and those people from Bangladeshi or Pakistani heritage backgrounds had higher risks of mortality than others. We also looked at occupation and showed again that there were inequalities in the risk of mortality from occupation. As we moved into the second wave, we've done exactly the same things, but we have started to look more at inequalities in catching the virus, and have, for example, just last Monday put out a piece which looked at occupational differentials in catching the virus. The headline result is really is very much linked to contact, and those people who are in contact occupations have a much higher risk of catching the virus than those who are not. The final point I would make is I showed a slide which again shows the inequalities that exist in the expectation people have of accepting the virus, and that again, sorry, accepting the vaccination, and that again is informing our policy in regards to vaccine hesitancy. Thank you.
Thank you, Sir Ian. Moving quickly over to Professor Anim on this question around inequalities and disaggregation, please.
Thank you, Jenna. I agree to the fact that this is an extremely important question. We have done 2 waves of both the household and the jobs tracker. For us to be able to get a better understanding of the differential effect, we're really pushing for the 3rd waves of each of these trackers. And in the 3rd wave of each of these trackers, we hope to get a good sample size. Our challenge now is that we had about 25% attrition between the 1st wave and the 2nd wave, and that is posing some constraint in terms of the smaller samples that we'll have to deal with in the 3rd wave and waves. But it's something that we flagged, and moving forward, we see how we're going to do that. Thank you.
Great, thank you. And over to you, Sandra, for some thoughts on the differential effects of COVID.
Thank you, Jenna. Principally, we have implemented georeferenced data with towards different concentrated level of COVID-19 by neighborhood. Also should development more small area statistic to improve the visibility of a small vulnerable groups. Thank you.
Thank you. And I know this very topic has been the subject of a number of webinars during the UN Statistical Commission, so we could probably talk about it all day. But we have a great panel of experts for the next part of the event, and so we're going to move swiftly on. Our next format will be a sort of interactive discussion with the panelists. We're so honored and excited. We have such a great group assembled here. We have Ms. Ola Awad, President of the Palestinian Bureau of Statistics, Ms. Mariana Kotseva, Director General of Eurostat, Ms. Linda Peters, the Global Head of Official Statistics at ESRI, Mr. Oliver Shiganya, Director of the UN Statistical Commission for Africa, Africa Center for Statistics, Mr. Anil Arora, Chief Statistician of Canada, and Ms. Shada Badi, Managing Director of Open Data Watch. Now, I'll remind the panelists to keep your responses brief, just to a couple of minutes. Don't fear, you have more than one bite at the apple, as I'll be circling back to you each with at least 2 or 3 questions, drawing also on questions from the floor. So I have some questions to ask the panelists to get us started, but I welcome questions in the chat, and we'll try to group these together and direct them to the speakers. So we're going to start off with a question, a common question that will go to all speakers, and I'll turn to you each in the order that I introduced you. The first question is, how has your organization, as part of the data and statistical community, responded to the COVID-19 crisis? So we'll start with Ms. Ola Awad from the Palestinian Bureau of Statistics. Ola, over to you.
Thank you so much. And I'm really very much privileged to join this important webinar. I will actually answering your question, although I mean with the not speakers they did, but I may say that as a national statistical organization, we jumped into action. I may say, as Stefan mentioned, and we took the initiatives in working and in defining actually what can we do. So the fact that the pandemic started in Palestine at a later stage compared worldwide, and this is also gave us a chance to look onto other experiences and practices where we took the initiative. And for example, we did the first economic forecasting. If a lockdown will happen in Palestine, what will be the consequences in different period of time when we looked on the other countries, what happened to them. And the time we provided to the government, they made actually the decision on the lockdown based on the economic forecasting that we took the initiative to provide them with. And that's why what I'm saying, it's really very much how you proact rather than how to react. So this is one of the important, I may say, experience that we had during the crisis. The issue also that, we invested in the available data that we have. So we have such a huge amount of available data. Actually, we also extracted data from the current surveys that we had. So to enable, all of our stakeholders, policymakers, to get use of the available data, we invested a lot in the dissemination tools. When we're talking about virtual and the lockdown, so there's no kind of face-to-face. So social media tools was actually our main focus of dissemination in different means and ways. And here I may add that we took really a lot of, good experiences from the joint projects that we have on the international level. We had a project with UNSC and ESRI where we had the story maps. And it was one of the best practices when we disseminated based on story maps on the vulnerable target groups and so forth. The other project that we really benefited from, the one that we have with the UNSD, the FID, where we had launched a portal on the pandemic, and it wasn't only for PCBS, it was for Palestine and for the National Statistical System. So this is where it was really how we took part and responded to the crisis. I may add,
thank you.
As just one more, which has been also raised before, that immediately we stopped all the field work, the data collection face-to-face to a CATI, and it was also a new learning experience. And we moved actually, we moved not only to CATI, but also we moved to change the nature of the surveys. For example, the indices, the price indices from monthly to weekly and so forth. Thank you.
Thank you so much, Ola. So many exciting things. I think that key message on being proactive, it really came out clearly. So over to you, Mariana, to give your perspective from Eurostat.
Thank you very much, Jenner. Dear colleagues, privileged to be a member of this nice discussion club. For the sake of time and building on the previous presentations, I would like to share maybe 4 key points, 4 lessons from our experience from our part of the world. First one, since we are Eurostat Statistical Office of the European Union, our particular role in this crisis was, and this is for me point number 1, to provide practical guidance for official statisticians to find harmonized common solutions in order to guarantee that the statistics which we produce, including new elements which our colleagues highlighted very well, elements of finding solutions to interrupted data collection or to using new sources, that we are approaching the issue in comparable and harmonized way in order to guarantee that the results at the end is comparable across the countries. So this seemed to be for us one of the crucial steps. We published on Eurostat website immediately in the first weeks of crisis, started with that, a number of guidance notes on different concrete topics. These guidance notes, of course, have been developed together with the experts from all our member states, but also what is very important, we try to ensure coordination before issuing the guidance note with our partners, for example, ILO, International Labour Organization, FAO, OECD, UN, so that what we have found a solution in Europe is compatible with the solutions in the rest of the world. Second lesson, what the crisis has shown, that it has been very useful to have a focused communication, a dedicated communication on the COVID. And concrete examples of that are, of course, the dedicated sections on the website. So Eurostat also has such a dedicated website section on COVID, which provides data for all the countries and EU, but also was an entry point to the dedicated sections of each of the countries. Another example are the dashboards which were created, of scoreboards, interactive publications where different indicators were put together in order to do a tracking of the crisis and the starting recovery. Another important point, third point, is I want to stress that it was important not also to have an external communication, dedicated communication to the users to facilitate their finding of statistical data related to COVID, but it was also equally important to have internal communication, very well organized communication with the staff to encourage, to motivate, to stay, let's say, together under this crisis. And final point, we realized, actually, I guess this is for all statistical offices across the world, but in the European Union, that we were not prepared for such type of crisis of such kind of scale. And of course, every organization has its own business continuity plans and crisis plans, how to react. But we were not prepared to have a crisis simultaneously, which will affect all, for example, our member states. And in that period of time, we had to find quick solutions under the bold leadership of the Director Generals of Statistical Offices in the countries. So we found, of course, solution, and we worked very well together. But what we did when towards the end of last year, we decided to put together an agreement, a voluntary agreement, something what we call crisis protocol, which we put together how to react in the future when something similar happens, hopefully not, how to collect, how to take decisions, what kind of information to collect, what kind of information to publish in order to take decisions really quickly, because the speed was important during the crisis. So these are my 4 points which I would like to share with you. Thank you very much.
Thank you so much. Very exciting to hear. We'll move swiftly over to Linda Peters from ESRI to tell us about how your organization has responded.
Yeah, thanks, and pleasure to be here. ESRI supports organizations during times such as this with our disaster response program. Our focus really has been on providing help in response to the pandemic, but also in maintaining business continuity and reopening communities. I mean, over the last 12 months, we've helped more than 4,000 organizations with requests for aid. A lot of these primarily were focused on technology, but some of them included the need for data or services, some help in execution. And our programs provided access to the ArcGIS system, allowing them to quickly set up hubs, right? We wanted to map resources and understand critical at-risk sectors to allow us to share information. And while hubs were really key in the beginning, providing that common framework, as the pandemic continued, we saw the need to create applications to help the community deal with various issues, such as optimizing site locations. So we began to create applications to map and manage testing sites, dashboard templates that allowed for the rapid sharing of information. We built tools to model the surge, such as the CHIME model or the CDC model. And we built apps for business continuity and recovery, a facility status application, helping us understand the operating capabilities, or a workforce capacity application, allowing us to monitor better workforce safety. And of course, supplying network resilience, providing the tools to visualize those networks and dependencies, disruptions and risks, right? We all had ITC disruptions as well. And all of these apps were made available at no cost via this DRP program. And today, we continue to focus on tools to aid in vaccine distribution. We have a new vaccine outreach solution, which will help you reach out to the community. And we're providing maps and apps to help with economic impact, recovery, and community resilience. So please do take a look at all of those things. We have tools to help all of the community. Jenna, back to you.
Thank you so much, Linda. And now over to a regional view from Africa. Oliver Shinganya, can you share with us how your organization has responded?
Thank you, Jen, and thank you to be part of this eminent panel of people here. First of all, for us, just to mention that, we've been working from home from March last year, the entire organization. So all our staff have actually been working from home, and some of them in their home countries. And that, of course, brings a lot of challenges in terms of how you do business. So a lot of things have happened since we started working from home. Most of the work that we do is online, providing technical assistance and so forth online. And we've identified new partners who would help us to provide some of the support. Some of them are actually on this platform that are helping us to ensure that we have the right support to countries. We've been able to develop new methodologies, and I'm going to talk to that a little bit later on. But let me just say that our focus is supporting member countries, and perhaps as I respond to the question, let me talk about what exactly we are doing with member countries on the continent. So when the pandemic set in, just like anyone else, we're not ready for it. We had absolutely no means of addressing it, and so were our countries. And given the capacity issue that they face, it even became much more difficult. So we thought we should conduct a quick assessment to actually have an understanding of what was going on in the country. So we did that a quick assessment to determine the impact of the pandemic. But the results were really outstanding, seriously outstanding in the sense that some of the statistical activities, as you've heard from others, they were halted. They could not do face-to-face interviews for obvious reasons, because there was no one to collect the data from. There was no anyone to go out and collect the data, to be able to do the analysis. So a lot of things were basically in disarray. Censuses were postponed, as you've heard even from Professor, that they're having to do the census this year and so forth. So many of the reason for all this is that the poor infrastructure that most of our offices have, the ICT infrastructure, the lack of the necessary regulatory framework that govern ICT, for instance, not being available, and also too much reliance on what I would call traditional methods, not tapping on big data potentials, for instance, data science possibilities, and so forth. These are things that were not really very familiar to countries. So what we do at ECA? So what we decided to do was to run several webinars with countries to just appraise them on a number of methodologies that would be great tapping to improve their systems. And one of them was, for instance, Customer Price Index, where we have also collaborated very closely with the Office of National Statistical Office under Professor Sir Ian to see how we can use the latest methodologies or new methodologies like web scraping, using of telephones and so forth, and also emphasizing to countries that they should use tablets, in smartphones, revamping of databases, the websites, and also development of the country dashboards to be able to access data. And in the process of all this, we've actually been able to tap on support of ESRI, for instance, as an example, Office of National Statistical Office. We've also worked very, very closely with partners within the Global Partnership on Sustainable Development to be able to bring new tools to the countries. So there's been changes over time. So, that's what we've been doing at the country level, at the regional level, but there are still challenges. There are still serious challenges because number of countries that are supposed to undertake census this year, they have not been able to because they don't have the capacity to do that. So we don't even know whether we'll be able to manage the 2020 round on censuses. So I'll leave it at there. Perhaps I'll pick up on the analysis in the next round of questions. Thank you.
Perfect. Thank you so much, Oliver. And now moving back to an NSO perspective from Canada, Anil Arora, can you share your thoughts on this question, please?
Well, thank you very much. And like others have said, a real privilege to be with this esteemed group. In our context, I thought I would take sort of what was our strategy, right? So 4 key points like Mariana. First is one has to be always aware of the context, how it's changing, be aware of the work that's happening in the international community, and just be active and prepared. And in our case, we were already in full transformation mode, modernizing and looking at things like what was our culture, how it was ready for innovation, what were some of the partnerships that were going to be important, because we're not the monopoly, more new players bringing out data and more data coming out from different sources. Using our infrastructure, how could we invest in it so that it could be more enabling? It could allow people to work from anywhere as a way of attracting new talent. How do we market ourselves so that we had greater presence in the market space and the trust and the transparency? Things like, how are we going to look at privacy, which we traditionally looked at on the output side, but how are we going to bring it to the input side of things so that we could actually access new sources of data? And I think the pandemic just brought all that preparation and training. Of course, we never predicted this was going to be the nature of this, but it took that 3 to 5 year horizon for us to implement that modernization and essentially laid it in front of us in weeks. And so, the risk of the status quo obviously was far greater than the risk of change that we had to implement. So that's the first thing, just being prepared, being proactive, having a strategy, being connected, and being ready. The second point was, as soon as it hit, we did, in sports analogy, we huddled and we said, what is going to be our strategy as we equip our staff? It's all about our people, and how do we change our leadership style and our governance from oversight and control and monitoring to enabling? How do we remove the kind of obstacles that we need to move out of the way so people can innovate, people can bring new solutions, and explore new partnerships? And it really did add, how do we add new opportunities? How do we go from outputs to outcomes and insights, going from the what to the so what to the now what, and really, bringing both people's excitement into new ways of doing things, new partnerships, but also making marginal gains to our programs all along the way. And that, I think, got our entire organization behind the change that we had to make. The third is the outcomes. We have never done as much. Interestingly enough, we are putting out more detail than we ever have, racial, disaggregated, local levels data, more timely data, flash estimates, you name it. And we are, through our marketing efforts, seeing our utility of that data increase by 2, 3, 4, 5-fold in many cases in different media all over. New partnerships and new services and new products. More microdata out to our researchers and our academics, which is great in an era of misinformation and disinformation. NSOs have to play a role of being the authoritative part. And 4, while we're in the middle of this crisis, while we're doing the census, we're now already preparing for the post-pandemic phase. And so here we are not waiting for the future to tell us what will look like, but we're saying what are going to be the key aspects that will determine for us what that future looks like. So we're planning, just like we didn't know what the pandemic was going to look like, but we're planning for the post-pandemic and saying, how do we not, in a sense, revert back to some of those ways? And I'm absolutely confident that a lot of this innovation, a lot of that trust in our space within both the international as well as the domestic scene will retain. So I hope that helps in terms of perspective that we took. Thank you.
Yes, thank you. Thank you so much. Great points, and a few that we'll come back to. Now, without further ado, and last but very, very, very much not least, is Shada Badi, the Managing Director from Open Data Watch, bringing a perspective from outside government, from civil society.
Thanks, Jenna. It's terrific to be part of this group representing the CSOs and non-governmental organizations on data. So Open Data Watch, being a watch organization, from the very beginning, we saw that there was a revolution really happening on data. And not only, you've seen it from today's discussion, there's a revolution going on from data demand, from discussions around issues of security, privacy, sort of balancing, how to avoid inequalities in data and whatnot. So one of the things we've been doing is we're trying to collect all the different discussions that are happening and try to come up with a way of assembling them and making them usefully available for analysts and for users. So we have created something called the data in time of COVID, and also I must say we work with the UNSC's division on the website that they have set up on data for COVID, particularly in light of keeping the NSOs aware of what's going on the relevant information for COVID. So this has been really useful to see that that sort of that assembly of knowledge. And we see that for every innovation, there are some risks also, and the discussions around those risks. You've seen like mobile devices is an innovation for data collection, timely data, but brings with it some biases. There are some issues with privacy as the data becomes more available, micro data, there are issues of privacy. So, the complexity of this community and the work that we are dealing with is to do that balancing act. And also seeing that there's a lot more people that are talking about these topics, the journalists, the think tanks, some of the think tanks that they never talked about data, like every other day you see something coming out from them about data. So it's really both good, and we need to take advantage of watching this. That's one thing. The second thing, we've been doing a lot on, of course, on open data. And we see that during time of COVID, open data has become very important for countries. Some of them have really explored this. I must say that there are good stories and the bad stories, some really bad databases and websites that have come up, but also many more countries are paying attention to what's a good website and what are the best policies and data use, terms of use that needs to be put in place for disseminating COVID-related data. So open data has become a big item. We've been helping with a number of countries and engaging with them. And in fact, today, right after this event, we are launching our ODIN Open Data Inventory annual report with various countries talking about how they have used these tools. The final thing that I wanted to mention, which is probably one of the most important work that we have done, is we're trying to see what are the, as you said, what are the differential effects of COVID. And in particular, we have noticed that the sex disaggregated data is a very big issue in both not time of COVID, but also for the building back better in future. So we've been looking at what are the data, sex disaggregated data issues, and we've come up with a sort of a framework for how to better analyze the data, which are understand better the women's and girls' vulnerabilities to COVID-19 pandemic, and sort of an agenda analysis of data. We have a dashboard that's available, and if it's either on Data2X's website or on ODW's website. So overall, we've been extremely busy. The work is not done. We are now turning our attention to solutions, and what are the type of solutions from all the things that we have learned on, really seizing this moment, and what are the solutions we can bring to build back better for going forward. Thank you.
Thanks so much, Shada. So many excellent points to bring in there. So we're going to take another round. We're going to go back to all the panelists. I have some questions that you are all prepared for. I'm going to weave in one or two additional ones that have come through on the chat just to make sure we cover them, because I don't think we'll have time to go through another round. Now, I'll remind all the speakers, we have about 20 minutes left in the event, and there are 6 of you. I'll let you all do the math because you're data experts. And thinking about how much time you have, and try to be succinct, but we're really eager to hear your insights. So to start with, I'm going to pose a question to both Ms. Ola Awad and Anil Aurora, bringing again the national perspective. The question we had for both of you was to tell us a little bit more about new innovations and steps that have been taken around data use and around the role of the NSO in strengthening trust in data and statistics. And Anil, I think you already touched on this a little bit, but I think that's really crucial. I want to bring in one additional question. If you can reflect on any lessons learned that you're taking forward For the production of the more traditional, regular annual or quarterly statistics that you normally produce around population statistics, death statistics, etc., from this experience in the pandemic. So just to switch it up, we'll start with Anil Arora, and then we'll go over to Ola for those questions. Please, Anil.
Well, thank you very much. Just in terms of your first question about new innovations and data use, there are dozens and dozens of examples, but I can tell you maybe just pick one or two. We've been working with the academic sector, which was really leveraged very heavily by a number of our provinces to come up with risk models and risk indicators. And so that was, how do you provide the kind of microdata that is going to be necessary in a secure way? So we had to, bring in together both the infrastructure expertise as well as the kind of data, the documentation that goes along with it, and support academics in developing those models. And they've been really, really helpful to some of our provincial colleagues in determining sort of, how do you, what's the level of lockup, where do you go about doing it, and so on. Another example is around the vaccine distribution. I think, as a couple of colleagues have mentioned already, it's about bringing in together different data sources, having a good geographical base. And so if you go onto our website, for example, we have something called the Canadian Geospatial Explorer, which you can go in and have a look at, what are the age groups in a particular region? What is the infrastructure in a particular region? What are existing health, conditions in a region? That's vital for vaccine distribution, and then, post-vaccine distribution, evaluating the impact of it. Like I said, we can, I can go on and on and on about, examples of how we're working with the business, sector, where we're working with Chamber of Commerce, and we launched a survey literally within days to get a sense of how businesses were doing during this time, what kind of challenges they face, et cetera. And that's been very helpful in terms of government programs for the kind of support that's needed. The kind of work on PPEs, protective personal equipment. How do you manage those inventories? And so we took on that task, brought on our modelers, and figured out how it is that we can better align demand and supply. So this is about using our expertise and our infrastructure as a service, like in addition to the kind of data that we, like I said, we can go on and on. There's so many examples of innovative ways in which data are being used and our expertise is brought to the table. Strengthening trust, I mentioned that earlier. It's about bringing in a new framework of proportionality and necessity. I talked about that at one of our UN sessions last year when we were physically together with a session I co-chaired with our privacy commissioner. New ways in which we can access data that we never would have before if we didn't have the kind of frameworks to allow for both privacy as well as digging deep into some very sensitive data types. So how do you do that at the front end? So anyways, there's a few examples there. I hope that helps.
Thank you so much. Over to you, Ola, for some reflections on data use and trust, and perhaps some of the lessons for the regular production of statistics. Go ahead.
Yeah, I mean, for the data use and trust, I think maybe I may say my message is I really believe that communication is the key. And it's the key trust for NSO's role, and that's really important. And from that perspective, I may say more engagement with the stakeholders, more engagement with the partners. Take the initiative of approaching our stakeholders and partners and let them be part of the whole process that we are actually working from setting up actually and also as National Statistical Organization being part of setting up the priorities of the country from the data. That's really important. The priorities that afterwards will be reflected in data. So this is really important. The other thing I may also mention, because so many things in my mind when you mentioned doing so is that how we can open many channels and communication with users. And what I'm saying, actually, it's not only for the use, it's part of the whole process and being part of this process. For the second question on the innovation, maybe the best example, because so many things we did, I may say, for the crisis, for the pandemic crisis, I think how we were really bringing reliable, timely data that reflects the impact of the COVID-19 pandemic on establishments, first round of the lockdown, the second round, and we continue. And it's actually a panel survey which gave such a great picture to help actually the policymakers to set up the intervention programs. And also the other one, which was really in cooperation with the World Bank on the measuring the impact of COVID-19 pandemic on the households, and which was really very important. And now we're running actually the second round, because the first one was such a real lockdown. The second one, it's a partially lockdown. The other example, which I really very close to my heart, is that we are working with different, target groups. We are working now with kids in schools, and we have such a competition, and we are actually having it to engage our kids in schools on engaging them with data. So to change this kind of perception on data. And also the other one, which is really much more tough, which is the one that we are working, it's called data science for policymakers, where we are involving the policymakers in that perspective. It's not as easy as the kids. The kids are much more smarter, but at least it's a kind of innovative way how they can be part and being really data scientists, whether they are kids or whether they are actually policymakers. The last example, I just want to add that we succeeded with a local university to have a joint bachelor degree program where we have the fourth year, it will be in PCBS. It's a bachelor degree on data science, and the fourth year, it will be actually as literary in PCBS, where each of the students will work on projects. Their projects will be here based on the priorities of the country. So where they will have actually graduated with projects based on the priorities of the country. And this is actually, I think if we succeeded, this is actually where we started. And I hope that we will succeed in this program. If we did, I think it will be really one of the great best practices that we have, an innovative one. Thank you.
Thank you, Ola. Really appreciate those points on sort of data literacy at all ages and all roles in society, because I think that comes back to the points about trust. The more data literacy there is, I think the less we suffer from the infodemic or the misinformation that's sort of emerged. We're going to move over now to hear back from Linda Peters at Esri and Shada Badi from Open Data Watch. And I do have a question about skills and competencies that have emerged, particularly with respect to the kind of coordination, collaboration, and partnerships that we've seen emerging during this time. But I also have a specific question to slip in for Linda, a question around geospatial capabilities and the extent to which you've been seeing traditional statistics embrace geospatial analysis even more. And an additional question for Shada, because you emphasized open data, we did have a question around privacy and privacy protections and balancing that tension. So I wonder if you can just touch on that. A reminder to everyone, I know I'm asking a lot of questions, but to be as brief as possible so that we can hear from Oliver and Mariana in the next round before we close. So over to you, Linda.
Yeah, thanks, Jenna. Thanks so much. I'll start out again with hubs. Data sharing hubs need to be put in place. I think we all have learned that. But in standing up these hubs, the key frameworks, such as the Global Statistical Geospatial Framework, have to be taken into consideration. I think what we've seen is there's been a recognition that GIS skills are critical within the statistical organization, and that the integration of GIS with these other systems will be important to how fast we can respond and start to make impact. We saw a lot of examples of problems, frankly, issues with geographies, geocoding accuracy as we're trying to align data from multiple ministries or sources. And the other thing we saw, which Anil brought up, was the issues of data privacy. Right? We want to look at data at the lowest levels of geography possible to be able to respond effectively while maintaining data privacy. So these are some of the things that we have to address. As I think about collaboration and partnership, partner data sharing agreements really should be considered now. That'll reduce the time to getting access to some of the critical data that we need. And I really do hope that we see much more collaboration with the mapping agencies and other key geospatial agencies, true partnerships that could help us leverage better their authoritative data. Just a word on models as well. I think there's new models that should be considered. We saw a lot of innovation over the last year. It's really something the community should be proud of. We're seeing much more consideration, for example, of mixed methods. I think a couple of folks mentioned that here today. But we have to consider things like connectivity constraints in those new methods and the impact that will have on our data collection. The lack of online infrastructure needs and being able to have applications that will work for us in the field in an offline mode. Those are things that technology companies like us are thinking about. But we're also looking at some of the newer hybrid models, for example, the focus on the generation of spatially disaggregated information, the use of GeoAI or data science like Ola was just talking about, spatial analytics. These could be used much more broadly. And really, I think one of the things we've seen is the need for more capacity strengthening in these areas. One other area to touch on, the assessment of the use of cloud technologies perhaps needs to be revisited. I know we all need to understand and adhere to privacy laws, but I think there is room for us to consider how to leverage cloud and web services wherever possible. And of course, open data policies in continual view, right, as to what's going on in our country. Just to answer your last bit on the embracing of geospatial, I mean, I think we saw a tremendous shift. Again, we've seen a lot of innovation, but I do think there's a long way to go yet in capacity. Thanks, Jenna.
Thank you.
Back to you.
Thanks so much, Linda. So over to you, Shada, for those questions around skills and competencies, privacy and open data.
I'll try to weave all those things together. I think what we've learned for the best skills that we really need to invest in, one is, and we see some of the great examples here, is data stewardship and data governance. And that is that countries really need to take this very seriously with all the different issues that we have around data and also the opportunities of how data could be really a valuable asset for governments is investment in data stewardship. Anil here, Ian, and of course, Ola, they're really good examples of when you invest in good data stewardship, what countries get. And one of the functions of the data stewardship is this balancing between data access, data availability, and privacy, of course, and setting up the infrastructure for data in the background. I hope my connections are not the issue and you can hear me. Jenna, can you hear me okay?
Yes, we can hear you. The video is
okay.
not great, but we can hear you clear.
All right. So what we're actually advocating for is called open data by default. And many people think that means everything. You open everything for open data. But actually what open data by default means is that behind it, there is good data governance and data stewardship, meaning that you only open things which you really have thought through and is on your what's called positive list. And then you also have a negative list of some of the items that are not yet available and they cannot be released. So balancing open data with privacy is a very important function that all data providers and governments need to play. And that skill needs to be built on. The other thing that very quickly I wanted to mention is what we're finding out is that we really need to invest in skills in planning better statistical systems and setting up data strategies. And one of the issues that we see, and we've learned a lot during the pandemic, is that there's not enough investment, financial investment in building statistical data. We, in fact, having a crisis, as you know, with the lack of domestic investment and international investment in data. So what we are advocating for through the BERN network, you've all heard of this coalition of different stakeholders around more and better financing for data, trying to see how, if there is not enough resources available for data, how can we do better through coordination and balancing between the demand and supply of financing for data. And there, Paris 21 is helping a lot in setting up a clearinghouse, which is very promising, and is going to be launched at the UN World Data Forum. So those are the skills that I just wanted to mention. And very important is really building skills on how can we do better planning and financing the statistical systems for future. Thank you.
Thank you so much, Shada, and for weaving that all together. That was excellent. So now with our last couple of minutes, we're going to turn back to Oliver and Martina. I'm going to ask actually a quite simple question, which is around the new approaches to data production and use that you've seen in your regions. What are those that have really worked? Can you sort of focus in on the lessons and those that have really shown to be very impactful? So we'll hear from Oliver first and then Martina. Over to you, Oliver.
Thank you. Very quickly, being the last speakers. Very quickly, I think one of the areas where we think it has really worked very well is the use of tablets, and as the others have said, also the smartphones, in other words, mobile telephones. I think this has been really very useful. We've seen the example, for instance, of Kenya, where a census for the first time was undertaken very shortly, and within three months the results are out. We helped to develop that platform, the tool that was used in Kenya. In fact, we used Ethiopia as an example, but unfortunately, Ethiopia hasn't taken up that census, and we're hoping that same application is going to be used in many other countries. But also, what we have also done is that we have created what we call a statistical collaboration platform. And this is a platform where the statistical offices actually put up their issues there to discuss and find solutions, particularly around COVID now. Everyone is trying to find a solution. So we have allowed a platform where the head of national statistical offices, the private sector, the academia to be part of that discussion. So those are some of the things that we are doing, but there's much more. And I think that having to work with partners that have tools and the capacity to help us move forward would be very, very helpful. And I think hearing from Anil, excellent examples there, perhaps we'll be reaching out to them among others. Thank you.
Well, I hope we've been able to foster some more collaboration on the webinar today. So over to you, Martina.
Thank you very much. I'm Mariana, but it's very nice to call me Martina because this brings me to New York in March, which is Martina's name. Okay. So I am the last speaker, so I'll try to be very, very short and functional. What were the driving forces for success under the sustainable production during the crisis? Number one, linking for new data sources, especially those who are outcome of digital revolution like big data, and linking them together. Second point, not afraid to do more towards modeling, estimates, because of difficulties or because you find the power of these new techniques. Third point, do not afraid to experiment and to publish, because don't try to be perfect. I think Anil said the same somewhere in the chat. Don't wait to be perfect, just have enough confidence to experiment and to go ahead. But of course, when you go ahead and communicate, you explain that what is the nature of what you are doing, that this is experimental and has certain caveats. Final point of success to emphasize, all this leads to extended partnership, mainly with research on new techniques, on new models, but also with the other organization, for example, like from the geospatial work like we have here, also with the NGOs, with any player in the society who could prolong the life of our data. And since I'm the last speaker, maybe I could take one last sentence. The crucial point now will be what we want to take with us when this crisis is over. Because there are many good elements, even the one which I just listed. If we will be able to provide sustainable access to these new sources, which we discovered during the crisis, if we are able to continue the fruitful partnerships and be more experimental, more innovative, that this is part of our daily work, and if we continue to communicate in this good way and find our new place in society driven by data, I think that at the end, when we meet physically in New York, we could say that we turned this crisis into opportunity for the official statistics. So thank you very much. I hope that we all have inspired you to continue reflecting on the lessons learned and shaping the future. Thank you very much.
Thank you so much, Mariana, and apologies for the error.
No worries. This is this reminds that it's better to be in New York.
That's right. I think I was thinking about someone else on the mind, but thank you everyone for such an incredibly rich discussion today. We had an incredible assembly here of presentations and panelists. This was a fantastic discussion, and really it's a testament to the incredible work that's happening at country level, in private sector organizations, at the regional level, in civil society organizations. It's really quite incredible. So we're going to wrap up now. I have 3 big takeaways from this discussion. The first is around being proactive, agile, innovative, experimental. We've heard so much about the incredible way in which National Statistical Offices particularly are just jumping in, getting it done, and being proactive. Secondly, is an incredible amount of cross-country, cross-organizational support and collaboration, perhaps even more than we've seen before, and really incredible to see how that's happening. And my last one is silver linings. I think it's incredible to see, even amidst the tragedy and devastation that has been brought by this pandemic, the hope and opportunity, as Mariana said, that has come from all of the innovation and all of the proactive engagement from the many organizations that are represented in the webinar, and I imagine from the many participants that have joined us today and well beyond. So that fills me with a lot of hope for the future in the area of data and statistics. So thank you ever so much for joining us for this high-level side of event. I wish you a continued success at the 52nd UN Statistical Commission and next year in New York. Thank you, everyone, and have a lovely day, afternoon, and evening.
Thank you, everyone. Bye.
Thanks.